Hi guys, it's me again. I want to give you one extra presentation beyond what Professor Montgomery recorded in previous semesters, which is the other videos you watched this week. I'm going to record one of my own. And the reason is I've asked you to do in the research notebook a very important step, step 7. And I'm going to give you some supplemental instructions so you can do step 7 to the level that I'm expecting, the level of quality that I'm hoping to see. So I'm going to quickly share my screen to show you what I'm talking about. Now, this is the research notebook. In step 7, it's called Brainstorm Keywords. And what you're going to be doing is filling out this keyword table. So at the top of the table, you need to copy and paste the concepts, searchable concepts that you came up with all the way back in step 5. You came up with 1 to 4 concepts. You're going to copy these and paste them down into the top of the step 7 table. So these should be the same as your searchable concepts you came up with in step 5. But then in the rest of the table, you will need to brainstorm synonyms for those concepts. Let me stop sharing and I'm going to share some slides instead of the research notebook. Yeah, and so what do I really mean when it comes to keyword brainstorming? What do I mean by concepts versus keywords? Whoops, sorry, previous. Okay, so the thing about concepts and keywords is that people leap straight into searching without thinking about their concepts and then thinking about the keywords that describe the concepts. And that's what leads to frustration and dead ends, which is why I'm having you spend so much time on this step. Okay, so what do I mean by concept versus keyword? A concept is like the platonic ideal of what you're trying to find. So a concept I may want to search on is the idea of children who have autism. Well, how do you say that in the English language? You say children with autism. Except for, wait a second, there's a lot more different ways in English to say that idea. Are we talking about childhood autism? What kind of child are we talking about? A youth, an infant, primary school age child, adolescent, teens, teenagers, high schoolers? There are so many different words that could appear in a journal article or in a book that you're hoping to find, that you're not going to find that thing unless you're considering those keywords in your search. What I mean is search engines are, they're kind of simple, right? They just do what you ask them to do. If you ask them to find children with autism, that's exactly what they're going to find. What they're going to miss is records that say teenagers with autism, because teenager to a computer is a different word than children. So it's important to consider keywords because we're going to need those keywords in order to tell the computer, in order to tell the search engine what I really want. I have to consider those additional words in my search when I type things into the search box. We don't know, there are highly relevant records out there about children with autism, but we don't really know what exact English language words those records contain. And that's why we brainstorm keywords. So here's what I mean. Assuming I'm a searcher, I'm a dental hygienist, I'm going to do a medical literature search on the question, in children at risk of developing cavities, does chewing sugar-free gum after meals prevent dental caries? And the dental caries is just another word for cavities, right? So when I look at this question, I use the PICO method to try to identify searchable concepts. So the P, the medical problem, dental caries, the intervention is sugar-free gum, and the outcome we're looking for is prevention. That gives me 3 strong searchable concepts. When I actually sit down and brainstorm keywords, I start to think, well, wait a minute. I might want to find records about sugar-free gum preventing cavities, but I might be just as interested in records that talk about the effects of sugar-free gum on dental plaque or tooth decay, which is another way to say cavities. And I have to write cavities down because dental caries and cavities To a computer, those two things are different. I'm going to have to consider both words when I do my search. For sugar-free gum, when I search sugar-free, there are actually a lot of different specific types of sugar, the alcohol sugars. So I've written all of them down, because think about it. When I find an article and it's talking about chewing xylitol gum, I'm just as interested in that article as an article that says sugar-free. I just didn't search the right word to find it. So I'm going to have to consider all these different words for sugar-free, for gum or gums. Now, gum and gums means something very specific in dentistry. It means, your gums. So I might want to search the more specific term, chewing gum. So when you're thinking about keyword brainstorming, think of broader terms, think of more specific terms, think of synonyms, and finally think of different word variations of word endings. So in the English language, the word prevention is a noun. However, it comes from a verb, the verb prevent. So we need to think about the verb prevents, prevent, preventing. We might also want to consider reducing or the reduction of tooth decay or all those beautiful synonyms for dental caries. This is the kind of work you need to do in order to generate a keyword table that I'm expecting in step 7 of your notebook. Here's the things that trip people up, okay? I see people searching long phrases in a database. If a searcher types the full phrase autism spectrum disorder, all 3 words, into a search bar of a search engine, that means all 3 of those words must appear in the record for it to come back in the search. You can see immediately that that's not really what the person wants to do, because there are plenty of articles out there that only say autism. They do not say the full phrase autism spectrum disorder. If I'm searching the full phrase, I'm missing articles that just contain the one word. So this is very important. You want to reduce phrases down to their core word or core phrase and get rid of filler words like disorder, right? Another problem I see is that searchers forget about verb conjugates in the English language. So a searcher might type in educating patients, but the search engine is not going to automatically know that the word educating has the same essential meaning as the word education. So that person will miss a great record that only contains the phrase patient education. And right now you're probably getting really stressed out because you're like, there are so many different ways to say educate. But don't worry, next week we're going to learn a trick that will take care of this problem for you. For right now, I just want to see evidence that you're aware of the problem and you're thinking about the word variations when you're creating your keyword table. Next week, we'll worry more about this. Okay, so about nouns, you need to think about adjective forms. If you're searching pre-diabetes, what about pre-diabetic? If you're searching pre-diabetes or pre-diabetic, what about the compound word pre-diabetic? To a computer, that's a different word. So you need to consider both of them. What about searching for beliefs? There are so many different ways to say beliefs. What about attitudes, perceptions, biases even? You need to sit down and brainstorm all the different ways to say that. And what will really help you is actually if you go run a couple of searches, read some articles, all of a sudden keywords are going to start jumping out at you. You can also use Google or Wikipedia, run a quick search, and all of a sudden, all kinds of synonyms will start jumping out at you. Now, here's what you need to remember to consider. You need to brainstorm spelling variations, synonyms, broader terms, and narrower terms. A broader term is gum, and a narrower term is chewing gum. That's what that means. So let's look at another example. So this PICO question is, in smokers, does a dental hygienist providing education about the negative side effects of smoking on dental health motivate patients to quit? Now, in the previous video, you heard that you really should only have 2 to 3 concepts. And that's true. Sometimes you can have a 4th concept, which is why your research notebook contains a 4th column. This one has 5 just because I'm trying to show you all of the different keyword variations you can come up with for these words, right? So here are the searchable concepts: smoker, dental hygienist, educational intervention, motivation, and smoking cessation. Here's what I ultimately came up with for brainstorming. For smoker, You also have to consider smokers, plural, which isn't even in this table because I forgot I left it out. Smoking, but you can also say tobacco use or a tobacco user. Those are also terms of interest. A dental hygienist, you could just say a hygienist, right? Because the word dental, I mean, hygienist really kind of only means one thing, right? If I wanted to open my search up to records about dentists delivering education on this topic, I could also do that. That's a related term. For an educational intervention, what that means is I'm providing patient education. I might just consider the broader term education and all of its verb variants, or intervention and all of its word variants. What about motivation? Again, the word variations motivates, motivating. I need to think about counseling as well. And counseling has a British spelling with 2 L's, so I've written that all out here. And induce or inducing was another student suggested that synonym to me. We're talking about smoking cessation. We also need to think about stopping smoking, quitting smoking. Those are important words as well. Let's take a look at a pharmacy example. So this PICO question is, in pregnant women with high blood pressure, does taking low-dose aspirin versus L-arginine supplements reduce the likelihood of developing preeclampsia? Now, we again have 5 searchable concepts. We have the patient's issue, high blood pressure, the intervention and the comparison, aspirin versus arginine, and we're interested in preventing preeclampsia. So for high blood pressure, right away, I know that there's another synonym I need to search. It's the medical term for high blood pressure, and that is hypertension. We might also consider the variation hypertensive, which is the adjective. For low dose aspirin, like I said, when you have a long phrase, consider removing some words to boil it down to just the essential concept. I'm just going to search the word aspirin, because instead of saying low dose, an article out there might say this specific dose, like 1 milligram or something. And that's low dose, but they didn't use the words low dose. So I'm just going to search aspirin to try to catch all of the aspirin records and then make a determination from there as to whether they're really about low dose aspirin. Acetylsalicylic acid is the chemical name for aspirin. L-arginine, I can just search the variation arginine. For preeclampsia, I have to consider that some people hyphenate that word because it is a compound word. So I'm also going to try pre-eclampsia. And for prevention, I learned there's another way to say this type of prevention is actually primary prevention. So that's a narrower term. I'm also going to consider all of the word variations, prevents, prevented, preventing, etc. If I were to go into the counseling discipline and take a look at this PICO question in Native American students who are problem drinkers, does motivational interviewing by a counselor lead to reduced alcohol use? So we have a Native American college student, the intervention is motivational interviewing, and the outcome is reducing problem drinking. With Native Americans, that might be the term that we feel most comfortable with. That is the term that is sometimes preferred. But American Indian is also used, and it might be used in the literature. So we need to consider both. We might even just consider searching Indian, which has another meaning, right? It could mean East Indian, but at least we broaden our search out, and then we can read the records to figure out which ones are really relevant. Using non-preferred terms is okay in searching. You're not saying you approve of the use of the term. You're just trying to find all the literature that might be relevant, especially older literature when the preferred term might not have been in use, right? College students, consider singulars and plurals, student versus students. University students, maybe we just want to search the broader word student instead. Or maybe we want to search about young adults or teens. With motivational interviewing, I had to do a search on this technique because I wasn't familiar with it. But when I Googled it, I learned that behavioral intervention or behavioral therapy is another way of saying this. Of course, counseling and its variant spelling with 2 L's are also need to be considered. And then for problem drinking, you could just use drinking. You could use alcohol use or alcohol abuse or even alcoholism. And blackout drinking is blacking out, that is a result of problem drinking. So that's a related term I have here. There's a speech language pathology example. Do children with phonological disorders who read with their parents have improved literacy outcomes versus those who only read in the school setting? This one is kind of unusual because there are a lot of different searchable concepts. Speech sound disorders, I had to do research into other ways to say that. I had to Google, I had to read some articles. I think I read a chapter in a book. And I came up with phonological disorders, SSD, which is an acronym, developmental speech disorders, and phonological disability. This required me to have some subject matter expertise, which is why I had to do that additional research. And that may help you in your table as well. For reading, consider all the different ways to say read, reads, reading, reader, readers, literacy. When you think about parents, there's a lot of different ways to say that, including parental, the specific terms, mother or father, caregivers, or maybe just even family members, right? For school, what kind of school do we mean? Do we mean preschool? We have to consider pre-school, which is a compound word. Do we mean in the classroom or in an academic setting? Here's a paramedic science example, which is kind of interesting. So in motorcyclists, does wearing a white or light colored helmet reduce the risk of fatal crashes? So here we have motorcyclists, helmets, white, and fatalities. And for motorcyclists, a broader term is just cyclists. Maybe we're also interested in bikes, right? Helmet, headwear, headgear. You might consider hyphenating those terms as well, which I didn't consider here. And then for white, how about light color? How about reflective? How about bright colors? Or how about just doing a search on color in general and seeing if there are other colors that could make an impact into this fatality fatality rate. And then for that, we can also search for death or deaths, right? So that's just one more example. I'm going to stop sharing here. So yeah, I hope that gives you an idea. Those were a lot of examples. I ran through them really fast. If you have particular questions, you can always message me and I'll be happy to help. All right, good luck with your keyword generation.